Thank you for joining today's update on COVID-19 in North Carolina. As of today, we have more than 116,000 lab-confirmed cases, 1,749 new cases since yesterday, 1,244 people in the hospital, and sadly, 1,820 people who have died. Our thoughts with everyone battling this virus, recovering from it, or mourning a loved one. Today, Dr. Mandy Cohen, our Secretary of our Department of Health and Human Services, will share an update on our key indicators and trends and where we stand in our fight against COVID-19. So now I'll hand it over to Dr. Cohen.
Great. Thank you, Governor. Today we will walk through our key metrics, and you'll see that some of our metrics are showing early signs of stabilizing. These early signs are a testament to the hard work folks have been doing across the state. They show what is possible when we all work together. Now, when we look at the states around us that haven't taken the slow approach to easing restrictions, and they haven't required cloth face masks as North Carolina has, it's clear that there is no one and done with this virus. It takes consistent and ongoing work to slow the spread of COVID-19. Our best weapons remain the 3 W's. Today's numbers make that abundantly clear. All right, let's dive into the data. As a reminder, we use a combination of metrics we look at over a 14-day period. We look at COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of total tests, and hospitalizations. Some of these indicators help us understand the rate of viral transmission in the past few days, while others, like hospitalizations, tell us about transmission and what was happening a few weeks ago. All right, our first graph looks at people who come into the emergency department with COVID-like symptoms. This is the most timely data we have, and it's our earliest detection mechanism. And this metric is not impacted by testing rates or other factors. So we take a look at the yellow line, and you can see over the last week that it has started to tick downward, but the previous 7 days before that were upward. So overall, over the last 14 days, we'd call this leveling. All right, here on our next slide, we look at laboratory confirmed tests. This is another of our more timely key metrics. This first graph on cases gives you a look at the trajectory of new cases since we had our first case back to March. But let's zoom in. It's helpful to get a better sense of the current picture with a little more detail. And as you can see, looking at the flattening of that yellow line, the number of new lab-confirmed cases of COVID-19 is leveling over the past 14 days. Now, on the next slide, we look at the percent of tests that are positive. Looking at the yellow line, you can see that the percentage of total tests is trending down to around 8% from 10%. And while I still want to see this number down to 5% or less, it appears headed in the right direction. The next metric is day-over-day hospitalizations. As you can see the upward sloping yellow line, hospitalizations continue to rise, and today is our highest day of statewide hospitalizations. As I've mentioned before, people who are going into the hospital today were likely infected days or weeks ago. That's why we call this a lagging indicator. This trend will take longer to stabilize than other metrics. Fortunately, we still have hospital capacity here in North Carolina, and we continue to monitor this closely. Okay, so where are we today? First, surveillance data ticked downward last week and is starting to level. It gets a yellow line. North Carolina's trajectory of lab-confirmed cases is leveling, but it's still high. It gets a yellow line, but it's a positive development. North Carolina's trajectory in percent of tests returning positive is declining, which is a good sign, but it still gets a yellow line because, again, we'd still like to see this number closer to 5%. North Carolina's trajectory of hospitalizations continues to increase, but we have capacity, so again, this trend gets a yellow line. We also track our critical capabilities, our ability to respond to this pandemic, and you'll see that testing has a sideways arrow. We're doing a lot of testing, averaging about 29,000 tests per day over the last week. But as you've repeatedly heard me say, we have concerns around testing turnaround times, supply chain issues, and the need for federal support. More and more states are raising the alarm about these challenges. On contact tracing, we are continuing to hire contact tracers to bolster the efforts of our local health departments and meet their ongoing needs. These COVID-19 community team members reflect the diversity of the communities that they serve, and almost half are bilingual. Our PPE supplies are stable. So the takeaway from today's data is that our actions to slow the spread of this virus are having an impact. Specifically, we see a direct correlation to the start of the statewide mask requirement at the end of June. 2 to 3 weeks after implementing this requirement, we started to see the beginning of these more stable trends. The 3 W's are working. I know it can be frustrating to have to wait to see these results. The actions we take today won't show up in the numbers tomorrow. Today's actions affect where we are a week from now, or 2 weeks, or a month. And slowing the spread takes a sustained effort from all of us. But let me be clear on my final point. Seeing glimmers of potential progress does not mean we can let up. It means it's time to double down. While we're stabilizing, these trends are still high. Adding nearly 2,000 new cases per day is still a lot of new cases. And this level of viral spread is stretching our response resources. As you saw, hospitalizations are up, testing turnaround times are long, and we continue to need to hire more contact tracers. So the positive signs in our trends should only strengthen our resolve to keep at it with those 3 W's: wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash. Thank you, Governor.
Thank you, Dr. Cohen. It's encouraging to see our numbers are stabilizing, particularly when other states are seeing spikes. But the numbers are still too high. In order to start a downward trend, we have to double down on actions that slow the spread of the virus. Other states have had to go backward when they saw sharp increases in their case numbers that overwhelmed their hospitals. Fortunately, we've avoided that. And it's because we've mandated masks and eased restrictions carefully in modest phases. We do not want to go backward. Stable is good, but decreasing is better. Slowing the spread of this virus requires targeted strategies that help lower the risk of transmission. To that end, and in order to drive down numbers and continue our trends moving in the right direction, we are announcing today a statewide curfew on the sale of alcohol at restaurants. Effective this Friday, July the 31st, restaurants must stop selling alcoholic drinks after 11 p.m. Bars will remain closed. We've not yet opened bars in North Carolina for a reason. Public health experts and examples from other states show that bars and other places where people gather closely together are a high transmission setting for this virus. We want to prevent restaurants from turning into bars after hours. And we're hopeful that this new rule can help drive down cases, particularly among young people. Several local governments have already taken this step. Their orders will remain in place as long as they are as strict or more strict. And our statewide order will go into effect anywhere that does not already have such a curfew. This will be particularly important as colleges and universities are scheduled to start, bringing people from all over the country to our state. We've seen case numbers increase among younger people, and prevention is critical to slowing the spread of the virus. We know this pandemic has taken a toll on people's health, but it's also impacted people's jobs and our economy. And as the end of this month approaches, I know that many families are concerned about rent and utility payments coming due. This is especially difficult now that federal unemployment benefits that were helping to cover those bills will be cut off abruptly due to inaction in Washington. I continue urging North Carolina's congressional delegation and all of Congress to put politics aside and do what's right as this pandemic still rages on. The $200 a week supplement the Senate proposed is not enough, and Congress and the President need to do more. And I know that our state legislature needs to do better when it comes to unemployment during a pandemic. Payments are too low for too short of a time. And the state legislature also turned away legislation to create a statewide fund to help support people who are hurting because of the pandemic. So my administration is putting in place an effort to help people with their rent and utility bills. We're putting together a plan using funding from the CARES Act, and we'll be announcing this soon. COVID-19 has made life difficult for families across our state, but it won't be this hard forever. We're encouraged that vaccine development is showing promise and that we can win this fight against the pandemic. For now, let's stick together and do what we know works to prevent disease spread while supporting each other. And that's how we'll make it through. Along with Secretary Cohen, with me today is our Secretary of Public Safety, Eric Hooks, and Emergency Management Director, Mike Sprayberry. Monica McGee and Brian Tipton are our sign language interpreters, and behind the scenes, Jasmine Mativier and Josiah Melendez are our Spanish language interpreters. We'll now take questions from the media, and if you can identify yourself and your organization, we would appreciate it, and we'll take the first one.
Our first question will be from Chandler Morgan with WBTV.
Hi, Governor. This is Chandler Morgan from WBTV. Charlotte-Mecklenburg Schools recently released their enrollment numbers for their full remote academy. Over 50,000 students enrolled. So for perspective, if that remote option were its own district, it would put it at the 5th largest district in the state. My question is, for larger districts like CMS, who are in a county that's considered a hotspot, why wouldn't state leaders encourage or ask those districts to go fully remote to minimize risks of exposure? Thank you.
Well, this is exactly why we have given districts an option to go fully remote, and many districts are taking this option. You have to consider a lot of things. The first and foremost has to be the safety of our students and our staff and teachers at our schools. That's the number one thing. But we also know that it is important to get our children back in school as soon as we can safely. And part of that is going to be making sure they get as good of education as possible, and that's going to involve some remote learning. Even with our Plan B, which requires less density, there's usually going to have to be some remote learning. So we need to make that as good as we possibly can and help equip our teachers with the tools that they need to make sure that we do this remote learning successfully. But that option is there, and many districts are taking it. Next question, please.
Follow-up, Chandler Morgan, WBTV.
Hi, Governor. A quick follow-up for you. Additionally, the President Donald Trump, he says that he will now accept his nomination in North Carolina. Has there been any communication to you and your team if this will be happening in Charlotte? And is there any worry about the draw of outside visitors that could bring to the city or state, given the progress that we saw today in COVID-19 case numbers?
He's welcome to come, but nothing has changed about our resolve to keep health and safety first. We have not heard anything from the administration or the RNC about this. Yes, obviously, we'd have concerns about people coming in and about a large crowd, but we'll continue to keep health and safety number one in this process. Next question.
Our next question is from Lynn Bonner with the News and Observer.
Hi, thank you very much for taking my question. Governor Cooper, I'm wondering why you decided to start the alcohol curfew now, and why you chose 11 p.m., and if you have seen anything that convinces you that such a curfew is effective.
So I'll let Dr. Cohen address this in a minute, but we know that the bar scene has been a place where we have seen increased transmission. This has been happening in other states. I saw the governor of Texas who said if there's anything that he could change, he would not have opened the bars, and we've seen numbers spike in Texas. We're getting some reports about some restaurants that essentially turn into bars late at night where people are less socially distant and less sitting at tables and more milling around and more up around the bar. So what we want to do now that we have become stable with our numbers, we want to drive those numbers down. And this is one of the ways that we believe will be effective in driving those numbers down. If we discourage that bar-type scene in a restaurant. 11 o'clock was chosen because we know some restaurants begin serving dinner to people at 9 and 9:30, and we just wanted to make sure that the restaurant part of the evening would be over and discourage the bar scene after 11 o'clock. Dr. Cohen, would you want to say something on that?
Hi, Lynn. The only thing I would add is I think these actions continue to show how we are trying to use our data to do targeted interventions that will slow the spread of the virus. A couple of the things that we're seeing, one is that, and you can see this on our dashboard, is that more of our cases are in folks who are younger. That 18 to 40 age group is where we're seeing more viral spread. And as the governor mentioned, we know within the next number of weeks we're going to see university and other college students return to campus. And so I think using a data-driven approach to say we knew that we did not want to open bars, we do not want restaurants to turn into bars, we do not want to have settings where there's increase in viral spread. I think you see us using our data to try to be very targeted to keep that virus level low, to continue the progress that we are seeing as our numbers start to stabilize. Thanks.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. I was wanting to follow up on, I guess, the last week or so involving the unemployment benefits. And you were mentioning that you've been encouraging the state legislature to try to either raise the weekly amount or the weekly number of benefit weeks. And is there any consideration about calling a special session between now and September 2nd toward that goal?
If we felt that we could get some positive movement from the legislature, that's certainly a potential. We know, though, that the state Senate proposed an increase in the state benefit, which the state House did not take, and that didn't end up being in the final budget. And there was no consideration given to extending the benefits. Now that we see that this virus is still raging across the country, now that we see that people are going to be out of work for a longer period of time, I hope two things will happen. Number one, that Congress will agree on additional supplemental money. It would be good if it would be the $600. It looks like it might be somewhere in between that, but that supplemental money is particularly important in North Carolina because our state legislature has provided some of the smallest benefits in the country for the shortest period of time. So we need, number one, Congress to help with that supplement, and number two, when the legislature comes back, we need to relook at North Carolina's unemployment insurance, particularly in light of this virus and what it has done to families across our state. And we also know that when people receive these unemployment payments, that money goes into the economy to pay bills, utility bills, rent, food, those kinds of things, and it'll also help our economy. Next question, please.
Follow-up, Richard Craver, Winston-Salem Journal.
Governor, I was also going to ask, given that the state borrowed so much money, was it $2.8 million or something in that, $2.8 billion in 2008 to 2011 to help with the Great Recession, is there any consideration about borrowing money again from the U.S. Labor or Treasury Department, or is that even a consideration?
I don't think that we're in need of having to borrow that money now. I think right now the trust fund is sufficient. So that's not something that we would consider right now. Next question, please.
Our next question is from Andrea Blanford with ABC 11.
Hi, Governor. It's Andrea Blanford with ABC 11. We heard from a group of Duke researchers last week concerned that lack of adherence to mask wearing in public could translate to lack of acceptance of a COVID vaccine when it's developed. Any concerns from you on building the public's trust in a vaccine? And if so, what's your strategy to build that trust? Thanks.
I think it's absolutely critical that we build public trust for not only the vaccine against COVID-19, but other vaccinations that are so important in keeping people and our entire population healthy. It's sort of like wearing a mask, that you're getting a vaccine not only to protect yourself, but to protect other people as well. And it's why we have these requirements for children to have vaccines before going into school. I think it's going to be important for state leaders to stand up, for doctors and others to talk about the importance of getting these vaccines in order to keep the population healthy. And I'll let Dr. Cohen address that too.
Hi, Andrea. Really important question. And I think trust is so important as we've been thinking about our response effort overall. One of the ways in which we hope that we are building trust with everyone is to be very transparent, particularly with what is going on in North Carolina. It's why our dashboard is full of data and we continue to put more data on there. It's why we continue to have these press conferences and be available. It's why we try to spend a lot of time putting out all sorts of material, but it can't just come from us. I think the governor is exactly right. This has to be a partnership amongst many folks across the state, leaders in very different sectors who can stand together to say that the response to this effort is important, whether it's wearing a face covering or getting a vaccine. Thanks.
Next question, please.
Follow-up, Andrea Blanford, ABC 11.
One more thing, Governor. President Trump was in Morrisville to see the progress of vaccine development here just yesterday. Did you support that visit? Do you plan to meet with Vice President Mike Pence when he's in town tomorrow? Is there any reason you did not meet with the president yesterday? Thank you.
We're very proud of what's happening in biotechnology and life science and medicine in North Carolina. I think this is one of the best, if not the best, hubs in the world for research. You look at remdesivir, the therapeutic. You look at the vaccine that's research that's going on all kinds of coronaviruses in North Carolina, and the clinical trials that are being held here. So we're always glad to have our nation's leaders come to North Carolina and be a part of it. I was just on the phone with Vice President Pence and other governors, along with Dr. Birx and Dr. Fauci, talking about the recommendations of the Federal Coronavirus Task Force. I don't know specifically whether I will talk with Vice President Pence tomorrow or not, but we certainly always welcome them to come to our state, and we hope that they will provide more federal help for us, particularly in the testing area. Thanks. Next question, please.
Our next question is from Gary Robertson with the Associated Press.
Hello, Governor. It's Gary Robertson. I wanted to go, you talked a little bit about these this help for people dealing with evictions or potentially late unpaid utility bills. Just to make clear, you're allowing that executive order that had told utilities not to turn off people's utilities. That was to expire tomorrow. Will that expire? And could you talk about what you envision this CARES money would do? Would it be designed to primarily help customers? Would it help local governments, or both? Thanks.
Thank you. Yes, the order will expire, and we have been encouraging customers and utilities as well as landlords and renters to try to work out payment plans, and discouraging strongly the shut-off of utilities or evictions. And the idea of this CARES Act money would be to make direct payments to utility companies in order to make sure that power was not cut off, or make payments directly to landlords to make sure that renters were not evicted. Some real concerns have been with city-owned municipal utilities. Have had a significant number of people who have not paid, and they're on the financial line, so this is of particular interest to them to be able to try to make sure that we keep the power on for these people, but also to make sure that their utilities can remain viable. Thanks. Next question, please.
Our next question is from Rebecca Martinez with WUNC.
Hi, Governor. It's Rebecca from WUNC. I'm calling, or I appreciate your time. I was hoping that you could tell me about, well, I know that the guidance you provided for public schools with regards to opening in the fall doesn't actually keep all schools closed like they did in the spring. So I'm wondering how that could apply to private schools. Vice President Pence is visiting Apex, a private school there. And even though Wake County Public Schools is starting with remote instructions because of concerns for parents and teachers about COVID-19, should all private schools be following what local districts are doing?
We certainly encourage private schools to take significant steps to protect their staff and their students, and I'm sure that there has been consultation with the Department of Health and Human Services. Would you want to comment on that, Dr. Cohen?
Sure, thanks for that question. And while our guidance is specific to the K-12 public and charter schools, we certainly encourage all of the private schools to take a look at all of those guidance. And remember that where we wanted to go forward was the maximum amount of safety precautions for students and faculty. And so that meant that we wanted to have everyone wear face coverings from K through 12, staff and teachers as well as staying 6 feet apart and making sure that folks are washing their hands, doing screening procedures as they enter schools. And now I know many of the private schools are implementing these plans. Some are using a combination of remote instruction and these altered safety plans in place. And we encourage them to continue to look at our guidance and to take and heed the warnings and concern that we have about viral spread in our state.
Thank you. Next question, please.
Our next question is from Kate Martin with Carolina Public Press.
Good afternoon, Governor. This is Kate Martin with Carolina Public Press. Thank you for taking my question. I'm kind of glancing over your executive order, and it looks like, and please correct me if I'm wrong, that if there's like an off-site event, like a wedding or a party of some kind, that they're not allowed, they can't cater any drinks after 11 and between 11 and 7 a.m. basically. What are the punishments if a bar or a company that has a liquor license violates your order? Could they have their liquor license taken away? I'm interested in any more details you can provide. Thank you.
Yes, our ALE, Alcohol Law Enforcement, and our ABC Commission is empowered under this executive order to enforce the law. And in fact, There have been some bars that have tried to open in violation of the previous executive order, and ALE has stepped in to say to them, hey, if you're open, if you're violating the rules, then you can lose your license. So those law enforcement officials will be ready to enforce this law. Of course, we hope that everyone abides by it. Next question, please.
Our next question is from David Mildenberg with Business North Carolina.
Hey, Governor, this is Dave Don in Charlotte. What are your projections showing the unemployment rate is going to be at the end of the year in our state? And on the weekly benefit, what do you think it should be?
We want it to be obviously as low as possible, and it did drop significantly to 7.6 just a couple of weeks ago. We know, however, that this pandemic is continuing to ravage across our country and that it's going to affect people's jobs. We also know, though, that people are finding opportunity in crisis, and we're seeing more jobs being created in the healthcare arena. We have continued recruiting jobs to North Carolina. We just announced a massive job creation in Charlotte with Centene moving there. So we know that there are going to continue to be jobs created, and that just means we've got to invest in education from cradle to career to make sure that people have the training. The workforce is still going to matter in trying to drive down our unemployment rate. So we want it as low as possible. We do know, however, that it is a challenge right now for a lot of people to go into the workforce and to work outside of the home, either for physical health problems or because their job has been cut. But we're going to continue to work on that issue for sure. Next question, please.
Follow-up, David Mildenberg, Business North Carolina.
Yeah, on the average weekly benefit, I think it's somewhere in the 275 to 350 range in North Carolina. What do you think it should be? Thank you for your public service.
Sure. Well, I think the Senate proposed it up to 400. It needs to be a little higher than that, though. When you look at what it costs people just to live and how difficult it is to provide for a family, then I think these benefits should be higher, and I think 12 weeks is too short of a time. And it's going to be critically important that we have a federal supplement to go with North Carolina's benefit because it is one of the lowest in the country. So that federal supplement is going to mean a whole lot. And we can do things for working North Carolinians too, like expand Medicaid, which will help all of the businesses out there with their health insurance premiums. Vice President Pence did that when he was governor of Indiana. We've seen a lot of states across the country in a bipartisan way expand Medicaid, and it looks like in the middle of a pandemic, this is something that we ought to be doing. Thanks. Next question, please.
Our final question today will be from Rose Hoban with North Carolina Health News.
Hi, Senator. Hi, Governor. Hi, Secretary. I'm curious about in last week's briefing, Secretary Cohen said that talked about partnerships between some testing sites and some labs, and just curious, why are some labs able to turn around tests quicker than others?
Hi, Rose. Thanks for that question. So a lot of this has to do with pre-existing relationships at certain healthcare entities that do the sample collection, that do the nasal swabs or nasal pharyngeal swabs, and where they're traditionally are used to sending their labs. They have relationship with our large commercial lab partners, as they should. We have a very, a number of commercial lab partners, whether it's LabCorp or Quest or Mako. And so they go to the relationships that they know, but there are more labs out there. They are smaller labs. They don't have quite the throughput. So we are doing a facilitating of some matchmaking, if you will, to some of these healthcare entities that are collecting the samples to say, if LabCorp is backed up or Quest is backed up and you used to send there, here's some other options you want to consider as you go forward. And so hopefully as we diversify the number of labs that we use, we can bring the turnaround time down for everybody. And I think we're looking at other mechanisms that we can work on to do improvements in turnaround times, including looking at other modalities such as antigen testing and pooling and other sorts of mechanisms. Thank you.
We have a follow-up from Rose Hoban, North Carolina Health News.
Thank you for taking my follow-up. I was wondering where we are on testing in skilled nursing facilities. Have we completed testing of all of the staff and residents? And so where are we with that? I'm guessing perhaps Director Sprayberry has something, knows something about that.
I'll start. So on the testing in our skilled nursing facilities, as you know, for a very long time, if there was even one case, we did testing of all staff and residents in those skilled nursing facilities. We went a step further to say we want to do proactive testing of staff in all of our nursing homes. We completed that very quickly in all of our state nursing homes, and then we partnered with CVS Omnicare for the state to facilitate not only the logistics, but if necessary, the payment for that testing. And we are working through all of our skilled nursing facilities. I want to say we're about 70% complete with that, and more happening every day. And by the end of this week, I believe we'll be nearly complete, maybe into the first of next week before that testing is complete. And then from there, we want to make sure that we have ongoing testing in place for staff. And I think testing is important, but remember, only one tool in terms of our overall strategy to make sure that we are keeping those in our long-term care facilities safe and that they are healthy. So we have a coordinated plan on how to do that. You can look at it on our website and download it. A number of steps from prevention to testing to oversight, and as well as helping them with workforce issues. Thank you.
Thanks everybody for joining us, and remember the 3 W's.